Hello everyone, I am Dr. Rishikesh and welcome to the first episode of Beyond Clinical Hours. But before we dive into the topic, I like to share a perspective that often keeps me reflecting. In a country densely populated like India, we, that is my team of dedicated doctors and myself, come across different patients who have different sets of complications. But by the end of the day, I am often left with one question that our society, which is reliant on the conventional therapy, has kept doctors' opinion and intervention somewhere down the list just to the point of diagnosis. With the impact of global pandemic, in which we all have suffered so much and we have experienced the sufferings all across the borders because of such a communicable disease. Even then, we have turned a blind eye to the slowly progressive chronic problems of the non communicable diseases. I'd like to welcome you all to the first episode of Beyond Clinical Hours. With this auspicious occasion of Diwali and World Diabetes Day, I like to emphasize on today's topic, that is the awareness of diabetes. And today with me is Dr. Pooja Khosla.
Hello everyone. Thank you Dr. Rishikesh for kind introduction. Now it's a season of festivity. This time we are with our family members and Deepavali is a festival of light and to enjoy it we have sweets. Now sweets are we enjoy this with our loved ones, but while doing that we indulge also, and especially for diabetics you have to be very careful because when you are consuming sweets your blood sugar levels are going to go up, and when you're with your family you forget to draw a line. So my message to you will be, please do everything in moderation, enjoy the festival, be happy with your family, but keep a check on the consumption of sweets. And after Diwali, we will be having onset of winter, which will increase the blood pressure and make you more prone to cardiovascular risk factors. And that is a time we should go for an early check of our blood sugars, because if our sugars go haywire while we are enjoying with everyone, we only get to understand that we have landed in a bigger problem because of some cardiovascular or some uh, neurological problem which can come post celebration in form of high blood pressure, high sugars, and it can culminate into a cardiac problem or a stroke. And we should also take care while we are enjoying the Deepavali that we don't increase the smoke in the air, as it is. There is a lot of air pollution going on, and this will make us prone to respiratory uh, infections, respiratory diseases, and worsen our breathing issues.
Ma'am, that was a very nice message which you gave on the occasion of Diwali. But in day to day practice, what we come across in our OPD, an elderly age group patient coming to our OPD who is already on treatment, any specific message to be given during this auspicious time, because it's a tempting season for everyone to have sweet.
So, uh, it's a very important question. Now, we often see elderly age groups, specifically over 60, when they have multiple medical problems, they are on multiple diabetes drugs, they could be taking insulin. When they are with their loved ones and they are rejoicing, they forget their medicines half of the time, and they may, when they are sitting together, they may take extra dose of sweets, and sometimes they forget to take their insulins. As a result, what is happening? Gradual increase of sugars. And when the sugars are increasing, they are not even monitoring, which they normally would be doing it maybe more often when they are not celebrating. And when the sugars are high, they keep ignoring it. Sometimes they forget to take their BP medicine, cardiac drugs. So the kind of a casual attitude comes when you're relaxed with your family and when you have children coming from outside, either they're coming overseas. So these scenarios are often witnessed, and when they come to know, Post festival, they come with high sugar with some complications, and then they will say, yeah, festival was there, they were a little liberal with their eating, and that's how the sugars are out of hands. This happens even at the time of Christmas. This happens very often when there are other festivals. Even for that matter, if the fast going on, people, the diet which they take to open the fast, it is very rich. Instead of getting a better sugar control, they end up with a worse control. People, they fast the entire day. When they open the fast, they indulge, they overeat, and that is the time their sugars are really skyrocketing. And then instead of reducing the medication, sometimes we have to increase the doses. When we check the 3-month sugars post festival time, everybody's HbA1c is climbed by 1 or 1.5. So this only indicates that they have been very casual about it and they have enjoyed that moment, they have celebrated it, but at the same time they have forgotten that they were diabetics, they were hypertensives. But that is the beauty of festival season. You are with your loved ones and you try to be yourself. But what I will like to emphasize on, once you've celebrated, please come for your checkups. Try to compensate for the casual eating and indulging.
Another thing, ma'am, which came to my mind is in my OPD, in my family members, and in amongst my friends also, who are in 30s, who are non-diabetic. But we read nowadays a lot online also that there are few risk factors which we have to consider and take few precautions. Can you just tell us about the risk factors which a non-diabetic who enjoy sweets a lot have to take?
So that's a very important point, Dr. Rishikesh, because obesity is mother of so many illnesses. Obese person with sedentary life is inviting number of problems which would get him into a series of complications. So obesity, then fatty liver, then uh, high blood pressure, dyslipidemia means high cholesterol levels, they are all coming as a lifestyle issues. So when we call a lifestyle issue, it gives a bigger responsibility to patient because the onus comes on patient to take a correct diet, to do a daily exercise, to take care of himself, to make regular visits to doctors, to achieve the goal, not even one time, but you have to be consistently taking care of your health to have a maintenance level. So, in an obese patient, we always ask them to go for a diet control, go for exercise, and go for a slow control over of their weight. We don't recommend sharp change in the weight because anything which you lose very fast, it comes back very soon. They should work on their diet, as in lose 1 to 1.5 kg per month, because it's a cumulative, correct way of losing weight which is going to help them. So, other than diabetes, in a non-diabetic patient, uh, problems which tops the list of lifestyle problems are your obesity, your cholesterol problem, your high BP problem. Then again, so many of these together combine to give you multiple issues.
Yes, ma'am. As ma'am rightly said, obesity is a major risk factor, irrespective of the age group. So, ma'am, many a times the patient coming to the OPD, non-obese, they keep on asking us कि our sugars are not controlled. Then later on, upon asking in the history, we come to know that there's a lot of stress in their life. So, I want to know your view about whether stress and diabetes are correlated.
So it's a very well asked question because this is a very common scenario. Same patient with same medication control, same lifestyle issues, they come with very uncontrolled sugars, and you ask them what has changed in their life, they'll say a lot of stress. So, stress is a killer state. It not only results in stress eating, your sedentary life, but it brings about changes in the body which increases the neurotransmitters which release extra sugars, and your diabetes goes for a toss. So, stress is a major contributor for uncontrolled blood sugars or uncontrolled hyperglycemia. And very often, just the control of stress gets the sugar better controlled.
So, if we put it in simple words, so the risk factors include obesity and stress. So, also does ma'am a genetic parental history of diabetes also have a role in our diabetes?
Definitely. So, diabetes is lifestyle issue. It is a genetic illness. It is got multifactorial illness, I will say, and it's not one factor. So, if you have parents who are diabetic, you have a very high chance of becoming diabetics. If both parents are diabetic, there's a very, very high probability that you will end up getting diabetes. So, people who have diabetes in family history, they should go for early checks, and they are the ones who should learn from their parents, and they should do more of a diet control, lifestyle modification, keep track of their sugars, because sooner or later they would become diabetics. But if they are managed to postpone the years of diabetes, it will reduce the complications of diabetes. Because what we try to do with diabetes is we try to control it so that we can avoid the short-term complications and the long-term complications of diabetes. And by complications, we mean heart complications, which are cardiovascular, which means heart attack, brain complications, by which we mean stroke, kidney complications, by which we mean chronic kidney disease, dialysis dependence, eye complication means a vision loss, and then vessels which are supplying our legs, which can result in a diabetic ulcer and a diabetic foot, then the nerves, which can cause numbness and burning of the feet. So, these are the complications of diabetes which we target when we talk about a good diabetic control.
So, the message is that the risk factors include obesity, a strong family history, and stress. Ma'am, if we consider post festive period, a patient who is regularly on treatment, who has celebrated and enjoyed the festival time very nicely with lavish, exorbitant sweets. So, does that patient have to worry about the post festive period as far as the complications are concerned?
So, we've just discussed that post festive there's worsening of our glycemic index, HbA1c goes high, and the complications will go parallel to it. Especially if in elderly we see that they come with different kind of illness, complications of diabetes, different infections worsen. In younger age group also, who become diabetic at a younger age, in 30s and 40s, they also have worsening of these problems. Now, these days we've seen that cardiovascular is not restricted to after 40. We're getting so many young MIs, myocardial infarctions, heart attacks, people who are going to gym. So, if we don't take care of our diet, if we are not exercising properly, and if we are just celebrating, maybe we do it for 2-3 days, it's okay. But if it becomes a longer duration, it definitely harms us, and it can worsen our liver functions, in terms of lead us to fatty liver. It can worsen our creatinines. It can have impact on our eyes. It can affect the nerves, specifically if the diabetes really goes out of hands. So in diabetic, what I want to give a take-home message, it's a systemic illness. It affects different systems, starting from head to toe, different areas like your in diabetics, you need eye care, you need kidney care, you need heart care, you need nerve care, you need foot care. In fact, for a foot care, it is emphasized that they should take care of a diabetic should take care of his foot more than his face. So every system has to be taken into account because it causes vascular complications which can be major and which can be minor. So basically, we should try avoiding these.
Yes, ma'am. Rightly said, ma'am. Ma'am, I'll also like to point out over here, many a times patients come to the OPD. They have taken their medications properly. At times they don't have their meals properly. And entire day they complain of nausea, vomiting, nausea, vomiting. At the end of the day, they land up to the emergency. What is this exactly happening with them?
So, Dr. Desai, this is a very important thing which all diabetics should be aware of, and especially people who have type 1 diabetes and even type 2 diabetics, which are poorly controlled, with who are dependent on insulin. If we are casual about our medication, we don't take insulin and we miss couple of doses, the patient can land up in emergency, even in ICU, because the blood sugars in the body, they start producing acid, and this complication is called diabetic ketoacidosis. It can be a life-threatening complication. It generally comes up with any second source of infection, and the patient presents with vomiting, breathlessness, abdominal pain, and they have uncontrolled sugars. So these patients, you should take them to emergency of any hospital, get the sugars controlled, get them checked, and then get the acid level assessed. If they have ketones in the urine, please get them hospitalized, because these patients, they generally become very sick and it can be very difficult to sometimes save them also, because diabetic ketoacidosis is a bad complication. There's another complication which is called hyperosmolar coma, which can happen in type 2, which works on a similar scenario, which is missing your insulins. The blood sugars go very high, they can go over 600, and there's a lot of dehydration. But these patients, they don't have ketones in blood. So these are both these scenarios, they have to be taken very seriously. But most important is it is very important to educate all our type 1 diabetics and people who are taking insulin not to skip their doses of insulin, because the consequences can be important life-threatening complications which will get them in ICU.
So now, ma'am, to tackle this, do you suggest meditation, yoga? Does it help?
So, it's a very important question, and it is very relevant because our life is full of stress. Because, especially staying in metropolitan cities, you have different pressures. So, anything which eases you, yoga, meditation, relaxation, will get the stress factor down. It will help your diabetes control. Again, I said diabetes is not just one factor, it is multifactorial illness. And the factors which are going to correct are also going to be multifactorial. In lifestyle modification, it is just not diet control, activity, yoga, meditation, relaxation will also contribute to reduction in sugars. And then, of course, your medication, and most important point, compliance. if you are taking your medicine properly, you're not missing your doses, you are doing your diet control properly, you are exercising, and then maintaining it, keeping track of it, and regularly visiting your physicians to get a consistent control of diabetes. One time, a lot of patients I've seen, they achieve a good HbA1c control, one-time control. One-time control is not what we are targeting. It has to be a long-term commitment. So all these chronic illnesses, they come with a huge commitment from patient side. And the commitment results in a good health. And it increases the longevity, it reduces the morbidity and the expense. So diabetes, BP, heart diseases, they are expensive illness because if you don't take care of yourself and if you land up with problems, you reduce your earning capacity, you worsen your quality of life, you end up in hospital with different complications, which again is a big burden on your pocket. So what you should do is prevention before it becomes treatment and carrying on the treatment. Complications is what you should be avoiding. So the whole concept of discussing all this is that these illnesses, we learn from the mistakes of our parents or our relatives around. These illnesses, they come with a huge cost. And if we adopt a preventive modality, we can avoid these complications and increase the quality of life and reduce the complications of disease.
So that means, ma'am, awareness plays a very important role.
Awareness, prevention, again, taking care of yourself, a good compliance, visiting your doctor, and chasing your illness, not one time, but keeping a track. Again, diabetics are very prone to infections. I will strongly recommend that in a preventive modality, they should be taking care of themselves in terms of they have more tendency to respiratory illness. So they should be regularly taking immunizations to avoid the anticipated infections.
So, ma'am, many patients must be coming to your OPD. So, how do you guide them or recommend them that how often they should visit the OPD?
Okay, so as far as follow-up is concerned, it totally depends on how good or bad their blood sugars are controlled. If the blood sugars are well controlled and they're maintaining their sugars well, once in 3 months is enough, 4 times in a year. But if the sugars are uncontrolled, then you take a regime from the doctor, visit your physician or diabetologist after 4 to 6 weeks, get the prescription revised, correct your blood sugar control. If you have any complications, depending, if you have complications, then the visits can be more frequent. So your state of health will determine how often you need to meet your physician. If you are doing well, once in 3 months. If you have a problem, maybe every week. That cannot be like made a generalized statement for all patients. It has to be individualized according to the situation, according to their problems and the complications.
Secondly, ma'am, many patients come to the OPD. They say that they find it very restricting to carry because they are on insulins to travel. So that's a inhibition which I have seen in my patients. They often avoid traveling because they are on insulins. So any opinion on this topic?
So now carrying insulin is not a mind block for people, and people travel globally with insulins. They can carry it in a pack, which is an ice pack, and there's a temperature regulation. And once they reach the destination, they can keep it in refrigerator. There are a whole lot of options for them. Not carrying the medicine and getting a bad sugar control and then leading to complication is the worst thing. So these days everything is coming in pre-filled pens, and there is no inhibition in using insulin. As far as use of medicine, including insulin, has to be done to the patient so that they clear their doubts and have a correct concept about their medicine while using it.
Thank you, ma'am. I think so our viewers learned a lot about the basics of diabetes and about the importance of having awareness rather than ignorance, and knowing the disease in and out, and not taking it as a challenge but accepting it as a part of life will definitely help them. Ma'am, I'd like to know your point of view about this and your message for the World Diabetes Day.
So we just want to connect with all our viewers that this is time where we need to know about diabetes very well. We need to educate ourselves why this preventable illness. We should know it before time, take care of every aspect, including diet, activity, medication, its complications, treatment, and keep a good follow up so that we can have a healthier diabetic life and have a quality of life minus complications. Our message is to be aware and prevent the complications.
Thank you, ma'am. And thank you all the viewers for joining us on the very first episode of Beyond Clinical Laws.